Yashaswini Vamaravalli, a prospective study of visual outcome and stabilization of cornea with cross-linking in keratoconus.
Role of collagen cross-linking in progressive keratoconus. This is a prospective study. My aim of the study to evaluate the effectiveness of conventional collagen cross-linking procedure in progressive keratoconus patients. Objectives are to assess visual outcome, changes in astigmatism, simulated keratometry values, Kmax, spherical equivalent after collagen cross-linking in progressive keratoconus patients. It's a prospective study which is non-randomized, single-center clinical study. 30 eyes of 28 patients were incorporated into the study from June 2022 to March 2023. So inclusion criteria: patients of age 15 to 30 years with progressive keratoconus are taken into account with a central corneal thickness more than 400 microns. Exclusion criteria: age less than 15 years and more than 30 years are excluded, and patients with maximum keratometric readings more than 60 diopters and with central corneal thickness less than 400 microns. Any patients associated with any ocular surface disorders, apical corneal scarring, previous history of any thermal or chemical burns, any association with autoimmune diseases, pregnant and lactating mothers are excluded. Methodology: all patients are evaluated for subjective refractive correction, slit lamp examination, corneal topography. All patients who satisfied inclusion exclusion criteria underwent collagen cross-linking under Dresden protocol under strict aseptic conditions. This is an overview of collagen cross-linking procedure. Under topical anesthesia, removal of corneal epithelium of 8 mm diameter with 20% alcohol. Corneal stroma was saturated with isotonic 0.1% riboflavin plus 20% dextrose solution, instilling 1 drop every 3 minutes for 30 minutes. Now stroma was exposed to UVA light of 370 nanometers at 3 milliwatts per centimeter square, with still continuing the installation of 1 drop of riboflavin solution every 3 minutes for 30 minutes. Centration of the eye should be maintained. After the procedure, cornea was thoroughly washed with BSS solution. Therapeutic bandage contact lens was applied at the end of the procedure. Post-operative medication and care: topical low-dose steroid drops were given in tapering doses. Topical antibiotic eye drops, topical lubricating eye drops. Post-operative care: dark goggles was advised to help from light, face hygiene, and avoid rubbing of eyes. Follow-up: the patients reviewed on day 1 and day 3. Therapeutic bandage contact lens was removed after complete reepithelialization of the cornea. Further follow-up was done at 1, at 3 and 6 months. These are the results. An evaluation of 30 eyes in 28 patients with a mean age of 19.8 years. Males of 64% and female percentage was 36%. These are the topographic indicators compared preoperatively and postoperatively at 6-month follow-up, represented in mean plus or minus standard deviation. Preoperatively, the simulated K1 value is 46.8 plus or minus 2.8 diopters, when compared to post-op. It is 45.7 plus or minus 3.35, which is statistically significant, and simulated K2 value, it is 51.4 plus or minus 2.97 diopters. When compared to post-operative value, it is 50.09 plus or minus 3.03, which is statistically significant, and Kmax values, it is 56.1 plus or minus 2.74 preoperatively, and post-op 54.38 plus or minus 3.24. This is a bar diagram showing changes in K1, K2 and Kmax values. Best corrected visual acuity at the 6-month follow-up is 1 Snellen line improvement in 33.3% of eyes and 2 Snellen line improvement in 46.7% of eyes, and the visual acuity remains stable in 20% of eyes. Astigmatism decreased by the mean of 1.65 diopters and remained stable in 23.3% of eyes. Spherical equivalent decreased by the mean of 0.73 at the end of 6-month follow-up. Kmax values are decreased by the mean of 1.67 diopters in 36.7% of eyes and 1.18 diopters in 43.3% of eyes, and remain stable in 20% of eyes. There is a decrease in corneal pachymetry by the mean of 469.26 microns to a mean of 385.26 microns. Complications are the immediate post-operative symptoms, which is redness, pain, watering, and mild photophobia, was seen in all cases, and there is mild stromal haze seen in all cases on post-operative day 1. There is a persistence of mild stromal haze was observed in 26.7% of eyes at the end of 6-month follow-up. Glare was complained by the patients with 33.3% of eyes. Sterile infiltrate was noted in one patient, that is 3.33% at 1 week follow-up, which is healed with medication, and no reported cases of progression. Conclusion: the results shows stabilization of the cornea and improvement in visual outcome in progressive keratoconus patients after collagen cross-linking. This suggests that it is a safe and effective procedure. These are the few studies supporting my study. Bhattacharya et al. In 2019, he has taken 78 eyes divided into 2 groups, a control arm and the treatment arm, and there is a improvement in and he was followed up for 1, 3 and 6 months, and there is a improvement in SIMK value, spherical equivalent, uncorrected visual acuity and best corrected visual acuity, which are statistically significant, and at the end of the 6th month in a treatment arm when compared to the control arm. And Parmod Guleria et al. In the study was done in 2017. C3R was done in 32 eyes of 21 patients with a mean age of 19.8 years. The preoperative values are compared with the postoperative values. After 6 months examination, there is an improvement of visual acuity, which is statistically significant.
Just one question. How did you calculate your sample size?
Sir?
How did you calculate your sample size?
Yes.
30 patients you have taken. So how did you calculate exactly?
Actually 28 patients, sir, 30 eyes.
How you are calculating your sample size? Because you will publish this paper and the validity of the study.
Yes.
That we want to know. Like. Why I am asking you this question? This is a very simple question.
Yes.
They may ask you.
Yes.
There are formulas from where you have taken, what parameters you have taken to calculate a sample size. With 30 patients, you cannot stamp that these things are happening.
Yes.
With 1.5 billion population and you are writing a 30 people sample size. Check on it, how you calculate your sample size.
Actually, I'm having a formula for it, sir. We have taken a significant level with we have taken few statistical analysis studies of keratoconus, and in the significant level was taken up to 95%, and sigma values are also considered, sir. Actually, I'm not able to remember the formula. Yes, sir. Actually, we have calculated over the formula, sir. I can show you. Thank you.